heart disease, diabetes, cancer, stroke, joint problems, sleep apnea, depression. These are all problems that are increased with childhood obesity.
The rate of kids being overweight in the United States has increased threefold in the past 30 years. So this is a huge problem.
Because when you say obesity, we're not just talking about the overweight kid, all right? We're talking about overweight America, period.
One of the things that's a huge problem is physical inactivity throughout the day. And what we see is that kids, basically about 56% of them do not get the 1 hour or 60 minutes of recommended physical activity every day. So it's about half of the kids don't get the activity that they need, because roughly about most kids ages 8 through 18 are watching more than 3 hours of TV every single day.
We have an incredible high percentage of preschool childhood obesity here in the Copper Country. I believe the national average is somewhere between 12 and 14%, and our average up here is about 24%. So I would say that is a big, big deal.
Somebody pulled the plug on childhood.
But there are simple solutions to battle this epidemic.
One is increasing physical activity. That is a huge, huge factor in obesity prevention. And that needs to start at a young age, because we all develop habits at a young age, and we need to have those instilled in us, that physical activity is fun, and we need to make it fun, and we develop a lifelong habit of being physically active.
7 days a week of 30 minutes of cardio plus 2 strength workouts a week equals a healthy lifestyle. That's the bare bones. I mean, that's not saying you're going to be an athlete or anything. That's saying you're going to be healthy if you can commit to that.
Another aspect is eating more nutritious foods as a family. Kids eat so many, junk food, high-calorie foods. We drink so much pop and other sugary beverages that are really kind of empty calories.
Nutrition is that critical. I mean, you've got to think about what you're fueling your body with. Whether you're an athlete or not, you need to be fueled for your day and for your life.
Eating more whole grains, eating more fruits and vegetables, and really watching high-fat, high-calorie foods and trying to minimize those would be a huge help.
So what is the Copper Country doing to prevent childhood obesity? The Healthy Kids, Healthy Communities project is promoting healthy eating by expanding farmers markets and community gardens in the region's 3 population centers of Houghton, Hancock, and Calumet. Their aim is to engage more local growers, cultivate enthusiasm for gardening, and give more residents access to fresh produce near home, work, and school. The group has already had success in starting the Pewabic Street Community Garden in Houghton, which provides a friendly garden space for people of all communities to gather, garden, and grow. The Healthy Kids, Healthy Communities project is promoting physical activities by implementing safe routes to school and other policies that support bike lanes, sidewalks, and traffic calming devices. Plans are underway to coordinate efforts of existing volunteer groups and nonprofit organizations that focus on physical activity programs for youth. One of these programs was to start the Treehouse, an activity center for kids up to the age of 5.
There's been some talk by parents over the years that we really need an indoor play space for children. Most winter cities have an indoor play space, so we formed a task force and met with a team of dedicated staff and volunteers to get the idea that we wanted to bring the outdoors inside. And that's what we created here.
For more information on this and other Healthy Kids, Healthy Communities initiatives, contact the Western Upper Peninsula Health Department or visit healthykidshhealthycommunities.org.